Good afternoon. Joining me today are Secretary of Commerce, Kelly Schultz, and Secretary of Housing and Community Development, Ken Holt. As the current surge of COVID-19 continues to ravage much of the country, Maryland remains in a better position than many other states, with the nation's 7th lowest positivity rate and the 9th lowest case rate. But it is clear that we are experiencing a post-Thanksgiving surge and that the worst days of the pandemic are still ahead of us. Maryland has now had 225,855 confirmed cases of COVID-19, including 20 straight days with more than 2,000 cases. Our 7-day statewide positivity rate dropped slightly today to 7.74%, and our cases per 100,000 is up slightly to 45.6. Today, for the first time, all 24 of our jurisdictions are in the red zone for case rates. The virus has taken the lives of over 289,000 Americans and 4,850 Marylanders. And the United States reached the grim milestone of more than 3,000 COVID-19 deaths in a single day. Today we have 1,720 COVID patients hospitalized in Maryland, which is our highest total ever during the entire pandemic. That includes 416 Marylanders currently in intensive care units, which is our highest level since June 6th. 88% of staffed acute beds in the state are currently occupied, and 87% of ICU beds are currently occupied. 143 surge beds are currently in use at the alternate care sites we added this spring. We are intensely monitoring active cases at 183 of our nursing homes and at 137 of our assisted living facilities. Since the beginning of this new COVID-19 surge, we have taken a series of aggressive actions to save lives, keep our hospitals from overflowing, and to keep as many Marylanders as employed as we can. Recent actions include issuing a public health advisory to limit all gatherings, limiting occupancy at retail establishments, bars and restaurants, and requiring them to close at 10 o'clock p.m. We expanded our out-of-state travel advisory, strictly limited hospital visitation. Again, we expanded hospital surge capacity and our alternate care site capacity. We activated a critical coordination center to transfer patients between hospitals. We mobilized an unprecedented medical staffing surge. We restricted visitation to nursing homes and expanded testing for residents and staff. We doubled the number of rapid response teams to assist with outbreaks. We provided additional assistance for food banks, foster care, and tenants, and we built an entire operation to deliver and distribute COVID-19 vaccines, which are on the way. We are continuing to constantly monitor all of the data, the metrics, and the modeling in order to determine what additional statewide mitigation actions may be required. While here in Maryland, we continue to take constant actions on a daily basis to fight this virus from all directions, Congress continues to fail at the one simple thing we have been asking them to do for the last 8 months, which is to provide additional emergency relief for our struggling families and small businesses. Earlier this week, I spoke with House Speaker Nancy Pelosi, along with numerous leaders in the Senate, about the ongoing negotiations in Congress over COVID-19 relief. We continue to stress to all of our leaders in Washington on both sides of the aisle the urgent need for them to reach a consensus on a relief package, even if it's only on a temporary Band-Aid approach that lasts for a few months. Something is better than nothing. Here in Maryland, we announced $500 million in state emergency economic relief. More than $215 million has now been provided through our COVID-19 Emergency Relief Fund to more than 16,000 businesses across the state. $50 million has been distributed to all 24 jurisdictions for our Restaurant Relief Fund to support both indoor and outdoor dining. More than $40 million has been directed through the Maryland Nonprofit Recovery Initiative to more than 1,800 nonprofit organizations across the state. Nearly $25 million has been awarded through our Layoff Aversion Fund to more than 1,000 small businesses from all 24 jurisdictions, saving another 20,000 Maryland jobs. We are directing more than $8 million to entities that rely heavily on tourism and visitors, including museums, zoos, aquariums, and cultural attractions. Nearly $5 million have been provided through our Maryland Farmer COVID Relief Program to more than 1,300 Maryland farm families. While we continue to wait for Congress to finally get its act together, today we are taking a series of additional state actions to help businesses struggling to hang on, to avoid the prospect of more layoffs, and to try to keep some businesses from going out of business. During this crisis, our small businesses have had to make very difficult decisions to move ahead with layoffs and furloughs despite their best efforts. As a result, many businesses are scheduled to face massive automatic increases in the unemployment taxes they will be forced to pay through no fault of their own. This is yet another blow for businesses already suffering tremendous losses. Today, I have signed an executive order to protect Maryland businesses from sudden or substantial increases in their unemployment taxes. This emergency relief will help more businesses keep their operations going and to help keep more people on their payrolls. In March, as part of our first round of state economic relief, we provided $75 million in emergency loans to Maryland small businesses. Today, I have directed the Department of Commerce to take immediate action to forgive the entire $75 million in emergency small business debt. These loans will be converted to grants, which will not have to be paid back. This will provide additional, much-needed relief to many of those small businesses so that they can stay in business and keep their employees on their payrolls. We're also announcing a major investment in affordable housing. We will be funding another $25 million in low-income housing tax credit projects, which will approve and promote the construction of 2,000 units of high-quality affordable housing, and which will create even more jobs. This is the largest number of units the state has ever financed in a single year. Today, we are also releasing $12 million through the Rental Housing Works program, which will spur even more projects and create even more jobs for construction workers and related industries across the state. In addition to these aggressive relief actions by the state, we are urging county governments to match the relief dollars that we have provided at the state level. And again, we are encouraging them to push out every single penny of their remaining CARES Act funding out into our economy and into the hands of the people who desperately need it in the next few weeks before it runs out at the end of this year. Today, we are also making additional new investments to address the health and well-being of Marylanders. We are committing $94 million in new grants and investments to help treat Marylanders with diabetes during the COVID-19 pandemic. More than 1 out of every 3 Marylanders either has diabetes or prediabetes, which puts them at a much greater risk and is the #1 comorbidity for people getting serious illness from COVID-19. With these investments, hospitals and their community health partners will be able to launch comprehensive community-based prevention and treatment initiatives and Care First will work with local health improvement coalitions to combat social and health disparities for people who have diabetes or who are at higher risk for diabetes. Today, we are committing another $10 million in investments to support a wide range of initiatives for law enforcement, youth services, and victim services, including a new COVID-19 Safe Futures Collaborative that connects crime victims to accessing the critical services that they need virtually. In addition to funding for PPE and protective barriers for the 34 district court locations across the state, rapid testing equipment and supplies for the Maryland State Police, as well as additional resources to increase internet access in Baltimore City for vulnerable children and youth. Tonight marks the beginning of Hanukkah, and I want to wish all of those celebrating a happy Festival of Lights. For each and every one of us this year, the holidays need to be a season of increased vigilance. Our hospitals are nearing capacity. Our death toll is climbing. We continue to be in a state of emergency with heightened levels. Hanukkah is the story of how a small group of people can make a powerful difference, and it is a celebration of the victory of hope over fear and light over darkness. And I think it's a powerful message for all of us, especially this holiday season. At this time, I'm going to turn it over to Secretary of Commerce Kelly Schultz to discuss some of our latest relief initiatives.
Great. Thank you, Governor. I'd like to also say happy Hanukkah to our friends celebrating tonight and throughout the rest of the week, and a very happy holiday and joyous season to all. I want to thank the Governor for the announcements that he made today. The business community, the employees, their families are extremely grateful for being able to get some of this ongoing relief. This year has been one of the most difficult and frustrating times that we've ever faced. We've been worried about our loved ones, and we've been worried about our futures. That's especially true for our Maryland businesses, which have faced numerous new operational challenges, as well as the lingering uncertainty of what lies ahead. From the very start of this pandemic, Governor Hogan and we at the Department of Commerce have been committed to supporting Maryland's business community and keeping our economy strong until we beat COVID-19 once and for all. We've provided hundreds of millions of dollars to support small businesses, nonprofit organizations, manufacturers producing PPE, artists and arts organizations, and tourism organizations. This effort was needed not only to protect the business owners in those entities, but also the hundreds of thousands of employees and their families who are struggling so much through this economic crisis. Our business community is diverse and varied, and that's what gives it strength. So we've tried to provide targeted assistance where it will have the greatest impact. For example, Commerce recently partnered with each county in Baltimore City to provide $50 million in direct assistance to the state's restaurants who have been particularly challenged this year. Through the governor's initiatives, we've provided $2 million to our local destination marketing offices, or DMOs, in all 24 jurisdictions to support the tourism marketing across the state. Tourism is an $18 billion industry in a good year. They've been hit hard. But the demand will return, and we want our hotels and attractions to be ready to seize that opportunity. With leadership from the governor, we turned a focus to our small businesses who do not typically have access to traditional forms of capital. Thus, we provided an additional $10 million to our Maryland Small Business Development Financing Authority, affectionately known to us as MSBDFA, to assist economically disadvantaged businesses impacted by COVID-19. We've also worked to protect our arts community in Maryland, which adds tremendous value, not just to our economy, but to our souls and our quality of life. The Maryland State's Arts Council is in the process of issuing its third round of emergency grants to more than 300 artists and artist organizations across Maryland, which will bring total emergency assistance for the arts community this year to $7 million. Commerce is currently processing and issuing our third round of COVID-19 small business emergency relief grants that the governor so gratefully gave us the last $50 million to get the rest of those applications through our queue. And I'm happy to say that all qualified applicants will now be given the grants that they had applied for assistance in the spring. All told, the small business relief programs have approved grants and loans totaling more than $215 million to over 12,000 individual small businesses and nonprofits in Maryland, and we're in the process of giving assistance to thousands more. Maryland's economy has made great strides since the onset of the pandemic. We've celebrated major economic development projects, such as the new Hagerstown Logistics Center in Washington County, Novavax's expansion in Montgomery County, which is projected to bring hundreds of new jobs, and Lidl's plan to open 10 new stores across the state. This is only the beginning of the economic advancements that we're making. We've signed a cooperative agreement with Quebec to support mutual growth in our life sciences and public health sectors, and dozens of Maryland life sciences companies have been working tirelessly to develop tests, treatments, and vaccines for COVID-19. Recently, as we've dispersed our small business grant and loan funding, we've even had a number of applicants tell us that while they have had a few tough months, they're doing okay now, and they want us to give those funds to another business who may need it more than they. The promise of that vaccine has given us all some much-needed hope. We can now see the end of the pandemic much more clearly, but we're not done yet. Our businesses and employees are still hurting and need more help. We're doing what we can at the state level, and today Governor Hogan has announced the important additional measures to help businesses, converting those $75 million in loans and grants and preventing steep increases in unemployment taxes next year. These are the kinds of actions that provide valuable lifelines to businesses that are on the bubble right now. But this is bigger than any one state. The Paycheck Protection Program has been depleted for months now, and America's businesses urgently need Congress to act to provide more relief. Whatever happens, we in Maryland must continue to protect ourselves and our businesses so we don't lose ground on our economic recovery. So we need people to stay safe. Yes, Governor, I'm going to say it. Wear the damn mask. Wash your hands. Social distance. Follow the rules and obey capacity limits when indoors. Don't take unnecessary risks. We've come so far in our fight against this pandemic. We've made great progress. We can't stop now. Help us, help yourself, and help your families. Be safe. And I am now going to turn it over to my colleague, Mr. Secretary Ken Holt.
Thank you very much, Secretary Schultz, and thank you, Governor Hogan, for your steady leadership during these very challenging months. And to the citizens of Maryland, thank you for your emotional and spiritual support. The Maryland Department of Housing and Community Development serves as the state's housing finance agency. We work to expand affordable housing and home ownership for all Marylanders. The department also invests in the revitalization and redevelopment of communities around Maryland. We try to spur economic growth, create jobs, and generally improve the quality of life for all residents. Now, as part of the state's response to the COVID-19 pandemic, our department has provided assistance to homeowners as well as to renters. And we've also coordinated a response with local continuums of care that address homelessness. And additionally, Governor Hogan had mentioned the various programs that support communities and nonprofits. Through our department, we've received approximately $146 million to drill down into grassroots Maryland and help all of those volunteer organizations that make a difference. Early in the state's response, Governor Hogan issued executive orders to prevent foreclosures and evictions to ensure that Maryland's families, seniors, individuals with disabilities could remain safely and securely in their homes, even if their ability to pay their rents was compromised by COVID-19. So to assist renters, our department has administered to this point about $40 million in rental assistance through two programs that have run concurrently. The first program, the Assisted Housing Relief Program, has provided about $20 million from April through December for low to moderate income tenants who live in state-financed projects. Additionally, our second program, the Maryland Eviction Prevention Partnership, has also paid about $20 million in CARES-related funding through the Community Development Block Grant Program to local counties for their direct rental assistance support. Now, we are set up to quickly deploy any additional funds that may be available from the federal government. And I add to the governor's admonition and to Secretary Schultz's admonition that it's time for the federal government to release more aid and support. Now, historically, the department finances affordable housing through loans and bonds, as well as administering the yearly appropriation of tax credits. These are low-income housing tax credits that come from the federal government. And we award these funds through a competitive application process. They are limited resources. However, they have enormous impact. Well before the pandemic, these funding sources empowered enormous construction of affordable workforce housing across the state. In excess of 20,000 units have either been created or rehabbed during the Hogan administration. And the additional funds that Governor Hogan has announced here today will add at least 2,000 additional units to that total. Last year, we broke all records with our low-income housing tax program. However, this year, those records are shattered. And I'm pleased to announce that we have finished our review process for the 2020 competitive round. And as Governor Hogan pointed out, there will be $25 million of tax credit financing that will construct over 2,000 units. And to build on the momentum, as Governor Hogan pointed out, there will be released an additional $12 million of rental housing funds. And these funds we leverage into the tax credits and to other developer financing. And it accelerates the construction of housing. It expands the pipeline and moves projects through more rapidly. And what does that lead to? More construction jobs, more engineering and design, and work for Maryland citizens. So, in conclusion, I'd like to thank Governor Hogan for providing us, the Department of Commerce, the Department of Housing, and all agencies of state government with the wherewithal to accelerate and execute a bold and aggressive economic recovery plan. Thank you. Governor. Excuse me.
Then we'd be happy to take some questions. Aaron?
You outlined a lot of economic stimulus efforts you've taken, and you also outlined a lot of the restrictions that you've re-implemented to try to blunt the surge. What is really left in your arsenal before you start doing what some of Maryland's other large jurisdictions have done and forbid indoor dining, or take a lot more of the stricter steps that we saw in the spring? What's left before then, and when might we get there?
Well, as I said in my remarks, we're taking actions every single day. We had meetings almost all day with all of our entire team, watching the metrics, getting all the advice and input. We're watching what's happening across the country and throughout the region, looking at the counties and our neighbors. We have a call tomorrow with Governor Northam and Mayor Bowser to discuss some regional approaches to the pandemic. And, as we've done for 9 months now, we will continue to take every single action that we believe is appropriate based on the data and the metrics and what kind of an impact it's going to have. And every day we try to balance all those competing priorities. We're trying to save people's lives first and foremost and keep our hospitals from overflowing, but we're also trying to keep as many small businesses open and as many people employed and working as possible. And it's a delicate balance. And we basically are looking at those levers every day and deciding at what point we should be taking what actions. And, we believe that at this point we're taking the right steps at the right time. But as I mentioned earlier, we're going to continue to take more actions as we see fit. And I imagine, we've been having press conferences almost every couple of days now recently, and but we're having meetings all day, every day, and taking action and making decisions, and I'm sure we'll continue to do so. And I would imagine we'll have further things to talk about, either, I guess there's not much left in this week, but next week sometime.
Governor, since we last spoke, so Anne Arundel County announced no outdoor dining. You mentioned the grant money that was given to restaurants to set up outdoor dining. Is that the right move for these jurisdictions?
Well, look, I don't want to second guess what the local leaders, a couple of them have done. I think there are two of them that I think have taken at Baltimore City and Anne Arundel County, talking about closing outdoor dining. I don't know where that decision came from, because in all of our hundreds of discussions with all the top public health doctors and epidemiologists and experts, they've told us from the very beginning that outdoor dining is safe, that outdoors is better than indoors. So, I'm not sure. You'll have to ask them why they made those decisions. It doesn't compute with most of any of the advice we've gotten from anywhere. And we just invested $50 million that we gave to the counties to help keep restaurants afloat and keep restaurant employees working by providing for money for heaters and tents and filtration systems and things to keep people safe dining outdoors. But it's not something that I think I would have done.
You mentioned the outdoor dining, you talked about that, but with regard to the halting indoor dining, why isn't now the time to do that if, as you mentioned, now all of Maryland's 24 jurisdictions are in that red zone?
Well, as I said, we're going to keep taking actions as we see fit. Indoor dining, is an issue if there are people crowded into bars and restaurants and not wearing masks. And so we took actions. First of all, we limited to 50% capacity. We reduced the capacity. We limited the hours to 10 o'clock, and we're encouraging people to stay safe, particularly if you're in a vulnerable category, to not go to restaurants. If you go to a restaurant, you should really take advantage of delivery or takeout or sit outside as opposed to dining indoors. But, we will take the actions that we think. That is not the number one source of transmission, by the way. And all of our contact tracing data shows number one source of transmission is family gatherings. So we don't want to prohibit people from seeing their families. The next is going to work and working in an office environment or attending other functions. And I think fifth on the list is indoor dining. So while it's important, and if we have to take those kinds of actions, we will. But I don't think, right now, I think the latest survey I saw, 69% of the people in our state do not feel safe dining indoors. We have a greater reduction in dining indoors than I think most other states in the country already, just because people are being cautious. But it is a death sentence for a number of these small businesses, so we will take those actions only when we really absolutely deem them to be essential to saving lives and stopping the hospitals from overflowing. Okay. Okay. Go ahead. We'll come back to you. We'll come back to you.
So there's a lot of people who are watching this, and there's a lot of county and city leaders who were hoping that you were going to announce statewide restrictions. They seem easier that way if it's blanket across the state. So I know you've been asked this in other ways, but why not do that today? And I'm sure you're a man who doesn't deal in what ifs, but if Congress passed another round of stimulus, would that make it easier for you to shut things down if you knew that we'd have money coming to help these businesses make it through?
Well, again, like I said in my remarks and into a couple of other questions, we are trying to make the decisions that are balanced and appropriate based on the facts on the ground, and we're taking all the ones we believe are necessary. As from the beginning, county leaders are able to make their own decisions about being more restrictive, and they have. Baltimore City and Anne Arundel, and in some cases Montgomery or Prince George's, have been taking different actions from us for 9 months. I respect their right to be able to do that, but we're not going to be dictated to what we should do based on what one or two other people decided to do.
Thank you.
Off topic, if that's okay. We're getting some reports of people getting bills from Easy Pass tolls while we know we don't have people.
I'm sorry, getting bills from what?
The Easy Pass, the tolls, we know that we don't have, they're not manned right now because of the pandemic. And they're given 30 days to pay these bills. Is that enough time for people to turn that around, given that they're facing extremely high penalties if they don't make those payments within 30 days?
Well, that's a question I think I'm not aware of. I hadn't heard that report, but it's certainly something we'll take a look at. I think maybe I'll have our communications team reach out to the folks at Department of Transportation, at MDTA, and see if they've got some answers for you.
Governor, given the fact that there are a number of jurisdictions, larger jurisdictions, making their own decisions and going a different way than you are their decisions?
I wouldn't say they're going a different way. They've always just moved, and sometimes a little more restrictive. They're not going. We're all heading in the same direction.
Are they going too far in your opinion?
I've said I was going to respect their ability. They're the duly elected representatives of those areas. It's very similar to, they've taken a few actions at the federal level, but they've mostly left it up to the governors to make our own decisions. And this same kind of concept that we're taking some actions that we believe are necessary, some of the more aggressive ones in the country, which is why I think our metrics are so much better than most states. But that those counties do have the right to, they can't ignore the state requirements, but they can be more restrictive if they believe it's the right thing to do for their citizens.
If no one else has, I want someone else. So it's a fiscal question.
You don't get the second one until everybody's exhausted, but it looks like no.
I wondered if when you spoke to Speaker Pelosi or maybe perhaps members of our delegation, you talked about federal help for the vaccine distribution program. For example, Barry Glassman said yesterday, the counties will be doing a lot of the administering, but they can't do it without money. They desperately need money from the Fed. What do you estimate that it could cost total for the state to deploy these vaccines?
Yeah, I didn't talk to the speaker and the senators about that because actually that's one of the things that they've done really, really well. And the vast majority of the vaccine distribution will be done through the federal government and through private entities, which we announced when we talked about our vaccine plan. All of the nursing home vaccination, which should be rolling out next week, is going to be done by CVS and Walgreens on a federal contract. All of the hospitals for our frontline healthcare workers, we're going to be delivering straight from the federal government to the hospitals, and they're going to be implementing it. Eventually, we're going to get to the point where every medical provider, doctors, and pharmacies everywhere, you'll be able to get the vaccine. There will be some limited, small amounts that will be done by the state and county health departments, and we'll be working with them. But I saw County Executive Glassman's comment. I think maybe heading up to speed yet on how it's going to all work, but we're certainly, it's not one of our pressing needs from the federal government because I think Operation Warp Speed and our state planning are going really well. I'm more concerned about the help for the people struggling in the economy, that when the Paycheck Protection Plan ran out months ago, when all the CARES Act funding disappears in a couple of weeks, that's really, so when I was talking with the leaders in Congress, it was like, the Republicans are pushing for this, and this is a line in the sand, the Democrats are saying this, and I pleaded with all of them to say, look, I don't care if it's a Republican plan or a Democratic plan. I don't even care if it's everything everybody wants. We have to get something out to these people that need it, and we have to have it now. We can't wait until next year. We can't wait till the new administration or the next Congress. It has to be right now, like this week.
Last question?
Touch about the CARES Act fund. Could you summarize for viewers who may not understand, how could this hurt Maryland if no additional funding comes, like for housing?
Well, I'm most concerned about the dollars into the people's hands in their pockets that are struggling, and there's so many people. We've paid out something like $9 billion in unemployment to 800,000 people, something like that. We put $10 billion in CARES Act funding out already. But the Paycheck Protection Program really kept a lot of people on the payroll and kept them in their jobs and that's all gone. That's why we're seeing a little more uptick right now. More people struggling right before the holidays. It's the end of the year. And there's so many things that they have helped with and that they can help with. But right now, it's really that economic. People are on a lifeline. They're at the end of their rope. And we're coming up to the holidays and the end of the year. We're going to have more people unemployed. We're going to lose more businesses if we don't get this help, which is why, while we still desperately need the federal help, we are exhausting and draining every resource we can to try to keep our Marylanders alive, keep them paying their bills, keep our small businesses, in business until they get their job done and get it to us. So we can, we've only got this much left. If they don't come, we're going to be in really a crisis situation economically. All right? Thank you.